now cross over to Burundi, where the country is currently seeing a surge in Mpox cases, especially in the northern suburbs of the capital, Bujumbura. While no deaths have been reported so far, officials say an additional 412 suspected cases were recorded between the 5th and the 19th of August. Burundi is one of 12 East and Central African countries experiencing a rise in Mpox cases. The Africa CDC has reported 1,400 new cases since the 13th of August, bringing the total to 18,900 across these countries, with 24 deaths reported during this period. The Democratic Republic of Congo, which has recorded the highest number of cases, is set to receive vaccines from next week. The treatment for Mpox is, however, costly in many African countries, with vaccines priced at about $100 per dose, making them unaffordable for many. Africa CDC now says it plans to secure 10 million vaccine doses by 2025. At a press briefing on Monday, the Director General, Dr. Jean Kaseya, announced a partnership with Danish manufacturer Bavarian Nordic to transfer vaccine production technology to Africa, aiming to boost supply and to cut costs as well. Okay, let's talk more about this. I'm now joined from Dakar, Senegal, by Dr. David Muganga. He is the Medical Manager for Emergency and Opening Services at Alima. This is a medical humanitarian organization. Dr. David, thanks so much for your time on this. Now, I know your organization has been at the forefront of containing the Mpox outbreak for some time now. What would you say are the challenges that medical workers are facing?
Okay, thank you, dear. And as you said, we are Alima. We are an international medical organization. And we are really involved in the outbreak response now in DRC, in 2 provinces, in North Kivu and in South Kivu. And we are facing actually some challenges. First is about the geographic barrier. You know that the security in eastern part of DRC is very tough. So the access to the healthcare is very difficult. And as you spoke before, there is resources limitations. And we are really facing the shortage in medical supply in terms of protective equipment, testing kits, and all those shortages make difficult the work of our health workers on the ground to take care of patients effectively.
I want to jump in because I want to talk about the vaccinations, with the vaccine manufacturer stating that it will be about $100 per dose for these vaccines. Will African countries be able to get enough of them to be able to contain this outbreak?
I don't think so. I don't think so. I can say that first, I'm grateful for the Japan government who give a donation of 3.5 million doses of these vaccines to DRC and also the USA. But as we know, we have the limitation of funding, and the African countries will have more difficult to deal with such kind of issues. And it's very important that people do the best to look for money to fund these vaccinations. Otherwise, it will be a great limitation for people to have access to vaccines.
I mean, speaking from a logistical perspective, how are your teams able to reach isolated communities? Because we're hearing of cases where those suspected, patients go to hospital when they have full-blown symptoms.
Yes, it's very tough for our team, especially now we are in a remote area in South Kivu called Kamituga. Is one of the epicenter of Mpox disease now. And we are really facing this issue related to security, to the access, even to travel from Bukavu to Kamituga, you need to go by motorbike, and it's very risky. So it's very challenging because of lacking of good route in DRC.